Hello everyone, and welcome to your supplemental lecture on neoplasm coding. Neoplasms are covered in Chapter 4 of your textbook, pages 152 to 162. Page 153 has a partial table for ICD-9 neoplasm coding. Please bookmark it, as we will be looking at it a little bit later on. Page 154 also has a partial neoplasm table for ICD-10. Coding of neoplasms in ICD-9 and ICD-10 is one of the more complex areas. Understanding the coding of neoplasms requires particular attention to definitions and to details. Concepts in this chapter may require a little bit more work. Okay, let's take a quick look at neoplasm behaviors. Neoplasm is any new or abnormal growth of body tissue or cells. This is not equal to a mass. Always remember that when a provider refers to a mass, that it is not considered a neoplasm. The term mass is also used to describe cysts and other thickening of organs involved with other disease processes. Okay, let's start by reviewing the definitions of some neoplasms. Malignant primary is the original tumor site. Remember that malignant tumors are considered primary unless documentation states that it is metastatic or secondary. A secondary malignancy or metastatic means that the tumor has spread to a secondary site. This site can be adjacent to the primary site, or it can spread to a completely different organ or part of the body. Carcinoma in situ means a malignant tumor or cancer that is localized and non-invasive, and it hasn't spread to any adjacent organs or tissues. Benign is a non-invasive, non-spreading, non-malignant tumor. Uncertain behavior is tissue that appears to be in a transitional phase, and its behavior cannot be predicted based upon examination of the specimen that was submitted. Unspecified behavior means that the provider has not given the coder the specific information in order to code the neoplasm correctly. This possibly can happen if a patient changes providers in the middle of treatment, and the new provider may not have access to the pathology reports. Usually, you want to refer to your neoplasm table first. However, if the histological term is documented, then you need to look for that term in the alpha index first. Your neoplasm table does not include neoplasms by histology. Okay, topography is a description of a region or specific part of the body. Neoplasms are classified by topography. Hopefully you have your textbook open to page 153. The table reads left to right and has 7 columns. The first column lists the anatomic site for the neoplasms. The next 6 columns follow what we learned on the definitions, reading from malignant primary to unspecified behaviors. Some neoplasms, like a malignant melanoma, the histology is included in the category and codes. Morphology is the term used to describe the neoplasm, but is not included in the table, whereas a description of the neoplasm will usually take you to which one of the 6 columns to find the right code. If you can't tell from the name if it's a malignant or benign neoplasm, you can look it up in the main index, or thank heaven for Google.